Here we are, Real Recovery Talk. I am your host, Tom Conrad. In today's episode, we've got Benjamin B.
What's happening, everyone?
And we got Dr. T.
Hello, hello.
First things first, thank you for tuning in on the podcast app, whichever one that you choose to use. And thank you for watching on YouTube. In the end, if you have any comments, questions, or concerns, you could always reach us info@realrecoverytalk.com. Again, that's info@realrecoverytalk.com. And ultimately, we want to help you turn your mess into your message, right, peeps?
Bingo, Tom.
Right, Tom.
Hey, also, if you want to get a PDF downloadable guide on how you can get help for your loved one, go to realrecoverytalk.com/guide. It's a PDF. It's a simple 1-page, 5 steps that you can take to get your loved one the help that they need. Again, it's realrecoverytalk.com/guide. Make sure you go there and get that. And it's that's a new thing that we put out. And then we're going to put you into our email chain and we're going to bombard you with emails. So yeah, but all good stuff, good content that people are thirsting for, Ben. They're thirsting for it.
So like my sound effects?
Yeah. Oh, boy. What's up, T?
Nothing. How are you today? Do you want to have a therapy session?
No. Why?
Grumpy Tom's here. He's drinking his Celsius. He'll be all right.
Celsius will kick in relatively soon, and I'll be ready to go. Right, Ben?
Yes, Tom. Yes, sir.
Yeah.
That's right.
All right.
We're all walking on eggshells here.
Okay, so here we go. I had a situation come up last week that I felt needed to be addressed. And I thought, what better place than, this here podcast where we get thousands upon thousands of people listening to, and they all need to hear this same story situation so they don't fall into this scenario. All right, so let me paint this picture. I'm driving in my car. I get a phone call from an alumni of ours who says, "Hey, Tom, I got somebody here that he's drunk off his ass. He needs help." The person that called me, he's alumni. Did I mention that?
Yes.
Yeah.
Yes.
He's alumni of ours and came through the whole entire program and is sober and doing very well. And that is, I think, one of our, if not our best form of marketing, right? It's just alumni talking about us. We don't spend money on Google ads and stuff like that. It's strictly word of mouth. So anyways, I get on the phone with this guy. He's drunk as hell, which is nothing out of the norm. And he's telling me how he wants to go to treatment and he needs to sober up and yada, yada, yada. So we have this conversation. It's probably about 30 minutes long. Come to find out, this gentleman has a service dog, and we know it's going to be a barrier for this person to enter into treatment, right? Because he doesn't want to give up his dog, which we hear that a lot. So anyways, conversation ends. Next day, this gentleman calls me in the morning, drunk as a skunk, but this time is threatening his life. And so I do what I have to do, and I get the authorities involved, and they go do a wellness check. They take him to the hospital, and he ends up leaving the hospital, AMA. Police go and pick him back up, take him back to the hospital. He leaves again. They take him back. He leaves again, yada, yada, yada. And he ends up back at home. And he's continuing to drink. And this is a real deal drunk. Like, hasn't stopped drinking, right? So this gentleman's brother ends up calling me, and I have a pretty good conversation with his brother, and his brother says, I've been down this road with him for off and on for 15 years. And I'm honestly, at this point, I'm pretty much done. I don't know what more to do. He's been in treatment numerous times. I don't have much more to offer him. I said, listen, I'm here for you no matter what. When he's ready to come to treatment, I got a place for him to go. And basically had everything lined up. And the brother calls me a couple days later and says, hey, just want to let you know that he's set up to go to a facility, and I don't know anything about the facility, but all I know is that this guy got involved, and now he's going to this other facility, and it sounds like, from what I understand, it's a primary mental health facility, and this guy that they've been talking to told us that he doesn't need to go to treatment for his addiction. He needs to go to treatment for primary mental health. And I said, okay, well, whatever, I don't, what am I going to do? It's no big deal, I suppose. Well, I end up getting on a phone call with the brother, his wife, and the guy that is representing this treatment center. And I got on this phone call by accident. They had both of us on the phone at the same time, and it's like they put the phones up together. And I simply asked this guy what his last name was. And he said, that's irrelevant to the conversation. And I'm like, okay. I said, I've been in the field for a long time. And, we probably know a lot of the same people. That's really the only reason I was asking for your last name, to see if I knew you. He says, yeah, that's irrelevant to the conversation. I said, okay. It's red flag number one. What's the big deal, And so I start asking him what levels of care, and he's like, oh, we have detox, res, PHP, and IOP. And then out of nowhere, he says, look, I've been doing this for 13 years. I know what I'm doing. And at that point, I'm like, congratulations. I said, look, I'm not trying to take your client from you.
Yeah.
I'm just simply creating conversation. Just want to make sure this guy ends up in the best possible scenario. Because keep in mind, I knew a lot about this situation, this guy's situation. He's a veteran. He's 35 years old. A lot of deployments. He was a Marine. A lot of trauma, So, and we've worked with those people quite extensively. And so I knew about this guy, and although I didn't know him on a personal level, never met the guy, worked with plenty of people like him, and generally speaking, we know how to treat these people, right? And that's all I was trying to do, was make sure that this person got into a facility that is gonna help him. And on top of that, he had been to multiple treatment centers. Now, the three of us here know we get repeat offenders all the time. People have been in and out of treatment 5, 10, 15, 20 times. And for whatever reason, they get here and something happens. Something clicks. What it is, it's a whole combination of things, but I think that, the community aspect, the family feel, we're small, we're all invested in their treatment. When clients enter in here, they pick up on that, they recognize that, and I feel like they feel like they're a part of something rather than just another client, right? So I genuinely feel like we can help this guy. But anyways, now he's getting diverted into a facility that is, mental health geared. And they do focus on substance abuse, but from my understanding, they blend them together. And, so he could be sitting in there with people that are actively schizophrenic, that are seeing shit climbing up the walls, that are, that don't have substance abuse issues. And, he's going to be sitting in a facility with these people. And I was so mad. Amanda was with me. My hands, I don't normally get this mad. There's two things that happen when I get this angry. Three things. One, my hands shake, my eyebrow twitches, and my lip twitches.
Oh, we've never had that, Tom.
You
before.
guys have never seen that part of me.
I don't want to see that.
And
Tom.
I was so mad. And I don't cuss in front of my wife.
It's because you care.
I'm like, that mother effer, blah, blah, blah,
Wow.
And so I end up, after I get off the phone, this conversation that I had with this jackass, after I get off of that phone call with him that I didn't even really want to be a part of, I called the brother back and his wife, and they were the ones that kind of, told me about all this. And I just spoke to him freely. I said, look, I don't know who that guy is. I don't care to know who he is. I could probably find out who he is, but it's not really worth my time. It's not worth my effort. He sounds like a typical business development rep at a treatment center. And he felt threatened that I potentially was going to take the client. And that's not a good representation on him. I said, now, I don't know this guy. I could be totally wrong. And they could have a very good relationship and they know each other from the past. And maybe he genuinely does know what your brother needs in terms of treatment. But just the way that he presented and the way that he was acting on the phone, I don't think so. And I told him, I said, my fear for your brother when he goes into treatment at this place is that he's going to be sitting in there with people that don't have substance abuse issues, that they're there for primary mental health. And I said, your brother is an alcoholic. So the fact that this gentleman said that he doesn't need to go into treatment for his addiction and his alcoholism, he needs to go into treatment for mental health, it doesn't make any sense to me. Because the brother was sober for a year prior to this relapse. I said, when he was sober for that year, did he have any mental health issues? No, he's a nice guy, was working, was doing well for himself, providing for himself, yada, yada, yada. And then he relapsed and now he's just gone off the deep end again. So if he was sober for a year and no mental health presented, is it a possibility that his mental health issues are a direct result of his alcoholism? Sorry, Ben had an emergency. He had to tend to this emergency. So anyways, that was the situation. And funny thing is that the brother called me maybe 2 or 3 days later, and the guy was in the facility for 45 minutes and left. Now, I'm not saying that he left as a direct result of the facility. I even told the brother this. I said, look, just given the fact that he wasn't even there for an hour and he left, that's not a direct representation of the facility. I don't want you to think that whatsoever. That's a direct representation of that he's just not ready. So.
Right.
Anyways, it really grinded my gears, T. So. I don't know. It's unfortunate because, the guy, addiction, alcoholism, it's rooted oftentimes it's all rooted in a lot of the same stuff. And it's treated, it's normally treated the same way. Whether you're, a combat veteran, a garbage man, a lawyer,
Right.
So what do you got?
But I think this goes back to the age-old debate as well. Some families don't know the difference between what is primary mental health and what is a substance use facility and what's a dual diagnosis facility. If they're just getting into it, even if they've had experience with it, I don't think many people are privy to those designations and what is appropriate for their loved one or for themselves if they're the person struggling with addiction.
Yeah, and the reason that I told this story is because we were sitting here and we wanted to record an episode on, and I've talked about this in the past, but it's always good to revisit the things that you can ask a treatment center if you're seeking treatment for yourself or for a loved one. There are questions that you can ask that we think that you should ask when doing kind of the interview process. So we'll kind of riff off of a few of those. And at the end, there is something that I do want to say that I think trumps everything. So yeah, T, what would you say one of the first things that you would ask a treatment center would be?
Obviously, what levels of care do they offer? What is their patient to clinician ratio? What's their average, group size?
Okay, so hang on. Let's take that one by one. Levels of care. Again, this can be, they're different depending on the severity of the addiction.
Right.
But in terms of level of care, if somebody's going to go full scope treatment from beginning to end, you have detox. Mm-hmm. That's going to be generally 7 to 10 days, right? Maybe sometimes 2 weeks. After detox, you have what's called residential.
Right.
Now, detox and residential, at least here in Florida, 9 times out of 10 takes place all underneath the same roof. So somebody will be in detox, and what quantifies somebody being in detox?
If they're on it's a medically managed level of care. So if they're, an alcoholic and they're on some type of benzodiazepine taper or an opiate addiction where they're needing to be on like a buprenorphine taper or comfort medication, it's a medically managed level of care where they have intense care and they see the provider every single day. And that's usually, obviously it depends on the person, but detox is usually 7 to 10 days, depending on how severe they are when they come in, how severe their addiction is, and how, many changes we're going to make day to day with medication.
Yeah. And so, the longest detox, generally speaking, is going to be with an alcoholic or somebody that's addicted to benzos.
Yes. Sometimes opiates, like if someone's on high dose methadone.
Okay, yeah.
Or very high dose. Let's say someone's actually on like Suboxone maintenance or something and they want to come off and they're on like 24 milligrams a day. To taper them down over 7 days is kind of inhumane. Yeah. So we would extend it out a little bit further. But usually the benzodiazepines, alcohol management, it's give or take. Sometimes we'll make it shorter, but most of the time it's longer than not.
Yeah, and it depends on how long somebody's been using.
Right.
If they're an alcoholic, that's 22 years old, the detox obviously is probably going to be shorter than your 60-year-old alcoholic that's been drinking every day for 40 years.
Correct.
But anyways, after the detox, then you transition into residential, and that's going to be...
It usually depends on each facility, and this is something a family or a person going into treatment can ask them. What is your average length of stay for detox and for residential? And if you don't offer residential, will you refer me to somewhere that does? Most residential programs, I would say, are 2 to 3 weeks in length. So the total stay between detox and residential ideally is, 28 to 30 days.
Yeah. And the only difference really between the two is while you're in detox, you're being administered meds. Well, you're being administered meds in res too, but it's less medical involvement.
Right. I usually try to tell people detox is a medically managed level of care. Residential is a clinically managed level of care where medical and the providers are driving the boat in detox level of care. Patients are on more restriction, in terms of their precautions, oversight with nursing, vitals, things like that. And then once they get into residential level of care, they're cleared by the providers to drop to that level of care. So there's less medical monitoring, and they then meet with their therapist to come up with their treatment plan. And it's a more clinically driven, like if they have a gym, they can do gym, yoga, some of the ancillary things that they cannot do while they're on detox level of care.
So that's going to cover you from day 1 to day 30. And then you'll transition into what's called a PHP level of care. And again, don't get wrapped up in the acronyms because the acronyms are primarily for DCF purposes and insurance purposes. But what PHP stands for is partial hospitalization. Why do they call it that? Do you know?
To be honest, I haven't even. I've thought that in my head. I'm like partial hospitalization. Like when I got into the field, I'm like, That must be an inpatient level of
Right.
care
At a hospital.
at a hospital.
Yeah. Or you're partially at a hospital.
Right. So to be honest with you, that's a good question. I don't know the answer to it.
So we offer PHP here, and we have nothing to do with a hospital.
Right.
So, but PHP is generally going to be day 30 to day 60. And again, it's kind of a step down from detox and residential. A little bit more freedoms are given to you. Still very heavy in the clinical aspect. You're meeting with a therapist on a weekly basis. You're attending all the groups. You have all your case management sessions. Maybe there's life skills aspect. But it's going to cover you generally from day 30 to day 60. Medical involvement is fairly minimal, once a week, right?
I'd say once a week. Like residential, usually twice a week you're seen. And then PHP is usually once a week. Also with PHP, you're living somewhere else, whether it's in a sober living associated with the treatment facility or you're living at home and coming in.
Yeah.
Whereas like detox and residential, you're living at the facility under their roof.
Right. Yeah. So again, day 30 to day 60, and then at 60 days, then you transition into an intensive outpatient level of care. Again, acronyms, don't worry about them. But it's pretty much what it is. It's an outpatient level of care, but the clinical involvement starts to titrate down a little bit. So you're not coming to group maybe every single day. Maybe you're only coming to group 3 days a week. You're still seeing your individual therapist once a week. Medication management, you're responsible pretty much for your meds at that point. You're seeing a doctor maybe still once a week, but maybe once every 2 or 3 weeks. It really just depends. And some insurance companies have different criteria, but an intensive outpatient level of care is going to carry you from day 60 to maybe day 120 or 150. It really depends on, the insurance and stuff like that. But as far as the housing goes, again, kind of the same with PHP. You can either be living in a sober living environment or you could be commuting back and forth from home. And then after that, you have outpatient, which is basically a group a week. You're meeting with your therapist and, now you're really getting ready to just kind of go out on your own. You have a super solid support base build up. You have a solid foundation and, it's ready. Now you're ready to, it's really where rubber meets the road, put all these tools into place or utilize them. And yeah, so I wanted to cover that because levels of care is important. And if you notice, we covered 6 months worth of treatment. In an ideal situation, say you're a mom or a dad and your son or daughter is, struggling with addiction and they enter into a treatment center and you have insurance through your employer, you probably have close to that in terms of coverage. Every insurance company is different, of course. I'm not going to, that's not a blanket statement, but it's been, our experience now over 10 years of doing this, that you got a solid 4 to 6 months worth of treatment at your disposal if you have insurance through an employer, so, and one thing that I do want to touch on in regards to this is oftentimes we see people want to bypass levels of care. It's like, hey, we'll get the phone call. Hey, I was wondering if I could enter into your IOP program. And I'm like, okay, well, when was the last time you drank? Yesterday. So you want to bypass detox, you want to bypass residential, you want to bypass PHP, and you want to enter straight into an IOP program? On what basis? On what grounds? And normally they come up with some cockamamie excuse. And it's like, sorry, we're not going to do that because it doesn't set people up for success. Levels of care are there for a reason, and they're not meant to be bypassed. Obviously, there are extenuating circumstances where that can be different, but 9 times out of 10, they're there for a reason. Yeah. So we covered the medical, we covered
licensed there, having
licensed therapists, the group size, length of stay. We covered that.
I would also ask about, do you have someone that helps with short-term disability and FMLA? Like most of the terms, it's case manager. Some places might be smaller, might not have a case manager. Maybe their therapist does that. But is there someone there that can help you navigate your HR and the paperwork trail that needs to be had for treatment?
Yeah. And I think that, transitioning, again, those are all questions that you can ask. Now, I did tell you that I wanted to leave you with something at the end. There's two things that I want to say. One being, don't do too much research, because what I see a lot of times is people, they'll call 10 treatment centers and ask all these questions to 10 treatment centers. And it's almost like information overload. Mm-hmm. And then you're left doing nothing because you don't know what to believe. You don't know what you need. You don't know what's going to be best for them or what's going to be best for yourself. And so it's just like, well, screw it. I'm just going to do nothing. I tell people all the time, pick, Google treatment centers in my area or treatment centers, in general for alcoholism, and pick a handful, 3 to 5 at most. And call them up and have brief conversations with them. Ask these questions. Now, here's the thing. You call a facility like us, you're going to get somebody on the phone like myself. You call a facility that is maybe a very large facility and they have, maybe campuses across the U.S., you're going to be diverted into a call center. The people that are answering the calls, they're trained on what to tell you. They're trained. It's a sales position, right? I'm not saying that's a bad thing, but just go into it understanding that you may not be getting the whole truth. They may not know the program as well as somebody like obviously I do or Tambini knows in terms of rock. Doesn't mean that's a bad thing though. It's, a treatment center is a treatment center. It is, and this kind of transitions into my next point, is any treatment is better than no treatment. There are some small caveats there. There are treatment centers that I've seen in the past that I would not recommend going to. I don't know any right now off the top of my head, because I feel like the ones that were that bad have been since shut down. But go somewhere. Don't get information overload. Don't over interview these places. Pick a handful of places and question them, gather as much information as you can and pick one and just send them, or just go if it's for you. And then the last thing is just don't have any expectations on it. Just because it's a treatment center doesn't mean that they're going to stay sober. A treatment center isn't a cure-all. It is a platform to allow somebody to kind of kick off their sobriety journey, but it takes time. It takes effort. It takes resources. Like there's a lot of twists. There's a lot of turns. There's a lot of, situations and scenarios that can take place. So don't just assume, well, okay, they're going into treatment. Everything's going to be okay now. No, there's going to be things that happen, and be understanding of that. Trying to think of what else.
There's a ton of like nitty gritty specifics we could go into, but I don't think they're overall big picture as important.
Yeah, I think in the end, if you're in this situation and you really don't know what to do and you don't want to call 5 treatment centers and you don't want to do all this research, we can make the process very simple for you. You can just call us. You can email us and, we'll have a conversation with you. I guess one of the first things that you can do is just go to realrecoverytalk.com/guide and download that PDF, and that will give you some good basic instructions on the steps that you can take to get your loved one the help they need. And, we have, I don't know, depending on when this episode is going live, we do have a membership available for families and loved ones in particular. But if you are an addict or an alcoholic and you want to get involved in this group, you can. There's opportunities there. Join our membership site and you can have access to myself, Ben Antiambini, on a bi-weekly basis. There's a curriculum that's involved and we cover certain topics week after week. And, that's obviously something that's available to you, and we'll support you every step of the way. That is, I like to tell people, that is going to be roughly a 6-month commitment. So don't go into this thinking that you're just going to do it for a month and try it out. I would do a solid 6-month commitment, because that, to go through the whole entire program, takes about 6 months. And in 6 months, a lot of things can change. A lot of twists and turns happen. And we want to be there for you every step of the way. For when these things do happen, we can kind of guide you on what to do. So, anything else, T?
No, I think we covered everything for the most part.
Ben was up and down. We apologize for that. So, anyways, that is it for this episode of Real Recovery Talk. Thank you for tuning in. In the end, if you have any comments, questions, or concerns, you can always reach us, info@realrecoverytalk.com. Again, that's info@realrecoverytalk.com. You can join our Facebook support group at Real Recovery Talk Support Group. Just type that in, click the join button, plug your email in, we'll let you in. And you can go to realrecoverytalk.com/guide to get our downloadable PDF on the 5 steps you need to take to get the help for your loved one. That's it. We'll see you later.